Hello class, I am Dr. Kaban. Today's video presentation is on Chapter 23, beginning in your textbook on page 398. The content of this presentation is admitting, transferring, and discharging patients. I will cover this content in two lessons. Lesson 23.1 will be on the content of admissions, and Lesson 23.2 will cover transfers and discharges. Let's begin. Upon completing your reading assignment of Chapter 23, as well as previewing my presentation, you'll gain the following knowledge. You'll be able to differentiate between routine and emergency admissions, describe the role of the admitting department, and also identify the elements included in a patient's orientation to the nursing unit. You'll gain the following knowledge and will apply it to the clinical practice setting. You can orient a patient to the patient unit and the hospital. And also, you'll be able to assist with the performance of an admission assessment. We're going to begin by discussing the various types of admissions. What is a routine admission? Well, routine admissions are those that are scheduled in advance. The primary care provider and the patient have agreed to the admission as the most appropriate way to address the patient's medical needs. The patient has had at least a short time to make plans and arrangements for this interruption in the usual routine. Many facilities do have specific units that provide for day stay or same-day surgeries. Generally, these patients will arrive a couple of hours before the procedure, and after a short recovery period in the day stay unit, they will go home the same day. Now we will compare emergency admissions to the same-day routine admissions. Well, emergency admissions differ, whereas these type of admissions are not planned. These admissions occur when there's a sudden illness, sudden injury, or abrupt worsening of an existing condition. Therefore, it will require the patient to be immediately treated or admitted to the hospital. Such admissions tend to be particularly stressful for not only the patient, but their close family and friends. In addition to worrying about fear about the medical problem, there may be prior commitments that now cannot be met or children who may need childcare. These concerns can have a direct effect on your patient's response to the treatment. So please be cognizant of these circumstances. Now let's review the admission process. Insurance companies and healthcare regulatory organizations mandate that specific criteria be met when an individual is admitted to the hospital. For routine admissions, these must be met in advance. However, in emergency situations, they can take place as the patient is being stabilized in the emergency department and prepared for the admission. Criteria include the authorization for admission, which is usually handled by the physician's office. Criteria also may include laboratory tests or x-rays. Most third-party payers require prior authorization for hospital admissions. In most cases, it is the responsibility of the physician's office to obtain this authorization. All payment programs and plans have criteria that define the service covered. Most plans do not cover procedures that are regarded as purely cosmetic. What is the primary function of the admitting department? Well, they are responsible for making sure that all admission criteria are met. They collect the personal and insurance information and verify the authorization for admissions. In many facilities, the admitting department is part of the business office, and they are responsible for making payment arrangements on insurance deductibles and copays. Prior to coming in for routine or scheduled procedures, patients may need to complete some laboratory work, X-rays, CT scans, or MRIs. They may choose also to donate their blood prior to coming in for scheduled procedures and surgeries. On the day of admission, patients generally arrive 1 to 2 hours prior to their scheduled procedure. In orienting your patient to the nursing unit, ensure to smile, make eye contact with your patient, and address them by their last name. Show the patient the location of the call bell, demonstrate how to use it, demonstrate the use of the television and telephone, show the location of bathroom and the use of emergency call bell, allow time to answer any questions they may have about the admission or their scheduled procedures. Ensure to explain visitation hours, and fill the water pitcher if the patient is not NPO. If they request information, please provide them with printed handouts of information if at all possible. Furthermore, assist your patient to put their belongings in the closet. Encourage them to send home anything they don't need, such as valuables, credit cards, money, or jewelry. Make a list of the patient's medications, then send the medications home. Notify the physician of any medications the patient is taking at home but that are not on the admission orders. List all the over-counter medications as well as herbal medications that the patient is taking. In the acute care facility, the assessment must be performed by an RN. Assessments performed according to guidelines listed in the nursing policy and procedures per that particular facility. Checklists may be allowed, but some form of narrative documentation is still required. In conducting your admission assessment, assess the patient's level of consciousness, vital signs, respiratory status, ability to communicate, vision and hearing abilities or difficulties, condition of the patient's skin, any prosthetic devices, and other health concerns. In initiating the medical record, the charge nurse is responsible for checking to ensure that everything is accurately transcribed. Admission orders usually need to be transcribed, and laboratory requests, consent forms, and dietary requests need to be sent. The nurse verifying the admission orders must check and verify the accuracy of each form before signing off the orders. In regards to admission orders, the individuals transcribing the orders should make a check mark by each order as it is processed. The nurse must read every laboratory slip, procedure request, and consent forms, correcting as necessary. A line is drawn along the left margin of the orders being verified, and then the nurse signs with the date and time immediately below the last order and the care provider's signature. Hospitals and other facilities have specific policies for noting allergies. Please note any deletions are crossed out with a single line with the nurse's initials, date, and the reason for the error written above the line. Every patient experience certainly varies. Patients may experience anxiety over what will happen to them, concerns about being away from home or work duties. They may be concerned regarding financial responsibilities, fear of possible diagnosis, fear of loss of privacy, or concerns about comfort and quality of care. Also, they may experience feelings of loneliness or loss of identity. Please be cognizant of these experiences your patient may encounter during their hospital admission. Preparation of the written plan of care is part of the assessment. This is done by the nurse with input from all the members of the healthcare team. The basis of the plan of care is the nursing process and nursing diagnosis. Okay, let's review a couple of questions. Question number 1. Tracy is admitting a new patient on her floor for a routine admission. A routine admission is best described as an admission with no prior planning, an admission for an injury, admission that was scheduled in advance, or an admission for a sudden illness. What is a routine admission? Please consider your response for this question. The correct response is C. A routine admission is an admission that was scheduled in advance. Question 2. Jessica is taking care of an outpatient surgical patient who is 70 years old and retired. She states, I hope that my doctor's office has gotten authorization for my surgery. Because Jessica's patient is 70 and retired, which healthcare plan does she most likely have? Is it A, a managed care plan, B, Medicaid, C, Medicare, or is it D, self-pay? Please consider your response for this question. Jessica's patient most likely has Medicare. Because Jessica's patient is 70 and retired, she would have Medicare, which is a medical coverage provided through the Social Security Administration. Let's move on. Lesson 23.2, Transfers and Discharges. Upon reading your Chapter 23 as well as previewing this presentation, you'll gain the following knowledge. You will be able to describe 5 types of information that must be included in the discharge form sent with a patient going to another facility. You'll be able to delineate the necessary information to include on a patient's discharge instructions when the patient is going directly home. And also, you'll be able to explain the procedure for pronouncing and recording a patient's death. You'll bring the following knowledge to the clinical practice setting. You'll be able to assist your patient with transfers to another unit. You would use correct communication techniques to ensure safe handoff to another nurse, department, or facility. You will interact with the social worker regarding the discharge needs of an assigned patient, and you will be able to demonstrate appropriate interactions with the family of a patient who has died. Now let's discuss reasons as to why your patient would be transferred to another unit or possibly to another facility. Well, changes in the patient's condition may require that the patient be transferred from one unit to another, such as from the ICU to a step-down unit. When a patient is transferred, the physician must be notified immediately. The patient's physician must approve the transfer. Transfers to another unit requires documentation of reason for transfer and the patient's condition at the time of transfer. Report is given by the nurse caring for the patient on the transferring unit to the nurse on the unit accepting the patient. In many facilities, the business office is notified of the patient's transfer. All patient belongings should be transferred with the patient. Loss of belongings can occur during transfers, so be cognizant to ensure that you transfer the patient's belongings with them. Label all the patient's equipment brought to the hospital by the patient with tape and the patient's name in large letters. Before transferring the patient, check the drawers for glasses, for hearing aids, and dentures. Discharge planning always begins at the time of admission. Discharge planners make appropriate discharge arrangements for the patient prior to the patient's readiness for discharge. When discharge orders are received, assist your patient as needed in notifying family or significant others. Collect the patient's belongings and assist the patient with preparing a ride home or to a new facility. In many facilities, there are discharge planners, case managers, or social workers that can help with this process. Patients may not be well enough to go directly home upon discharge. In these events, patients may need to be discharged to an extended care facility or rehabilitation facility. RNs complete a detailed patient information sheet for the receiving facility. Any records to be transferred with the patient must be ready in an envelope before the transporting vehicle arrives. When discharging your patient home, please verify travel arrangements prior to discharge. Prepare any written discharge instructions for your patient and review the instructions with the patient as well with their family members or caregivers. In some cases, your patient may be discharged home with home health care. This may include skilled nursing visits, such as wound care, diabetic care and diabetic education, or as well as the administration of IV medications. They may also be prescribed physical, occupational, or speech therapy needs, as well as respiratory care. In addition to all that, the patient may receive personal care performed by a home health aide. Remember that all patients have the right to make their own choice. They also have the right to leave against medical advice. Make sure that the patient understands the risk for leaving AMA. Offer to have the patient talk with a physician or supervising nurse. If the patient chooses to leave AMA, have the patient sign the AMA form. If the patient refuses to sign the form, it should be documented in the nurse's note. If there is a death of a patient, the patient must be pronounced by a physician. In the home care setting, if the patient is on hospice, a RN may pronounce the patient with a physician's order. Document the following in the nurse's note: the time that life sign ceased, time death was pronounced, and the name of the person making the official announcement. Autopsies are required in most states for certain conditions or may be requested by the family. The next of kin is required to sign the permission for autopsies. Often death is a difficult time for many patients' families and friends. As a nurse, it is important to offer your gift of support and just being there for your patients' families and friends. People need to grieve. It is an important step in healing. Offer to call priest, minister, rabbi, or spiritual advisor. Allow the patient's family and friends adequate time at the patient's bedside to say their goodbyes. Autopsies again are usually performed when the patient has died of unknown causes, has died at the hands of another, or has not been seen within a specific period of time by a physician. Autopsies may also be performed when it is felt that information valuable to medical research may be obtained. Organ donations may be requested by the patient. This is usually handled by a physician or specially trained nurse. When handled in a sensitive, caring manner, Requests for organ donations can be an opportunity for the family to allow something good to come out of a personal tragedy. Healthcare workers must be culturally aware regarding organ donations. Now it is time for us to review our final questions for this presentation. Discharge plans are developed by members of the healthcare team to organize a discharge for the patient. When does the discharge plan begin? Is it A, on admission, B, within 12 hours of admission, C, within 24 hours of admission, or is it D, on the day before discharge? Please consider your response for this question. The correct response is A. Discharge planning begins at the time of admission. Question 4. Which of the following is not a consideration when ordering home health care? Is it A, reduced cost, B, being in a familiar environment, C, decreased exposure to potentially serious infections, or is it D, physician's convenience? Consider your response for this question. Well, the correct response here is D. Home health care is not for the physician's convenience. It reduces costs, it allows the patient to be in a familiar environment, and decrease exposure to infections. Final question. When a patient wants to leave against medical advice, also known as AMA, it is important to A, calm him by saying you understand that if it was you, you might do the same thing. Is it B, explain that if he leaves early, all his bills will be paid for the time he was in the hospital only? Is it C, have him wait until he speaks to his physician? Or is it D, let him leave, try to obtain an AMA form and document it in the chart? The correct response here is D. Let him leave, try to obtain an AMA form and document it in the chart. The end. This concludes my presentation on Chapter 23, Admitting, Transferring, and Discharging Patients. Please be sure to read the chapter in its entirety. Thank you.